So this is AA4FL, the microphone, Jay, down in Hawthorne, Florida. For those of you on 20 meters, we also have a Zoom simulcast. We're doing a roundtable discussion today about saunas and dry heat, the health benefits, and some of the science behind that will be led by Bob, K4RLC. I'll let Bob give you a full detail here once we start the net. And in first, I'd like to start off that our president, WB1 FFI, Barry, is here with us. Barry, would you like to make some announcement? I'll turn the mic over to you.
Thank you. This is WB1FFI Insurance. This is yours, Barry. Just a few things. We had our board of directors meeting last week for about an hour in the evening, and we discussed a number of pertinent topics for the organization. More information to follow on those specifics. With regard to Marshall business, we have a ham vacation coming up in February in Florida, in Orlando. We will have a presence, a hotel block, which will be reserved. Although we will not be having our annual meeting there this year, it will be in May in Xenia. And again, a hotel block will be maintained. We'll provide additional information through our Ether, AETHER newsletter, which will be coming out shortly. There'll be an excellent net this morning with Bob Conder, which I'm looking forward to. It should be of wide interest. Really appreciated also for Bob taking the time to do this. And that's pretty much it. So just a happy holiday season to all. And I'll send it back to Judy at WP5D in Hawthorne, Florida. Thank you.
Okay, this is AA4FL at the mic for Whiskey Bravo 5 Delta. Thank you, President Barry. And I'll chime in as secretary. Yes, we are getting ready for an Ether edition. We'll be summarizing the board meeting as well. The last board meeting we just had, we have a video available for use. And momentarily, we're gonna start our program. Now, I'm going to remain as net control, and Bob is operating through amateur radio as well. We're doing a Zoom simulcast.
Yeah.
So we're gonna pause for identification. I see we've got Alana K4AAC on board too. Bob's wife was also in the same profession, so I imagine she'll take her turn at the mic as well. Nice to see you, Alana. Thank you for joining us. This is the Medical Amateur Radio Council of Grand Islands Internet, a long-standing net for many years on this frequency. Thank you for all amateurs that allow us the frequency, the use of the frequency. The reason why we do a Zoom simulcast is there are many of our members that have changed their geographic locations, and they maybe don't have access to the net anymore, or developments that don't allow amateur radio antennas. So it gives everybody a chance to participate. So thank you for your understanding. We'll try to get the technology. We only allow licensed amateurs to speak here. We can't allow guests that aren't amateurs to participate and ask questions. But they're certainly welcome to listen on Zoom. So please, if when you do come get a chance to the mic, as being net control, I'll give individuals a chance to be at the mic, announce your call sign, and we'll pause for identification every 10 minutes. And periodically, I will allow late check-ins. We'll make late check-ins. And the entire amateur community is welcome to join us. That being said, Bob, K4RLC, I'm ready to turn the microphone over to you. Thank you for being here today. If you would start off and telling us a little bit about yourself and your professional interests, and go ahead, Bob. K4RLC. This is Whiskey Bravo 5 Delta.
Okay, Jay. This is Bob, K4LC. Sorry, I'm running 4 monitors here, and hopefully you're seeing the slide on the full screen.
Yes. Do us up.
Okay. Thank you for asking me to do this. You're talking about ham radio and health. I think a lot of us will say ham radio helped us get into the health professions. Got interested in ham radio when I was a young teen. And it really helped with learning neuroscience. I look at the brain as a transceiver, but it's a poor transceiver, low amplitude, low power, bad filters. But we can make it better, and that's a lot of what I've been doing. Most neuropsychology is just assessing the brain, looking at it functional, how it's working, attention, concentration, memory, learning, executive functioning, as opposed to structural, the MRI, structural sort of a photograph. Uh, I was trained in rehabilitation medicine at the Medical College of Virginia to work with traumatic brain injury, stroke, other neurologic diseases, and the non-brain diseases like spinal cord injury, but how to make them better. So for years, we ran a lab in a neuroscience center with neurology, Raleigh Neurology, one of the largest neurology practices in the United States, Triangle Neurosurgery, and we did the neuropsych assessment. And my patients would say, "Okay, doc, you say I've got memory stuff. What can I do to make it better? I don't want to get Alzheimer's." And at that time, that we decided to publish a paper and look at the empirical science behind. I'm trying to run a monitor here. Behind non-pharmaceutical interventions, because in 28, well, we started writing the paper in 2017. The pharmaceutical interventions had a very modest effect. Things like donepezil, Namenda, Exelon. And now, unfortunately, they still have a modest effect, even the new IV medicines. And my practice was involved with phase 2 clinical trials for the IV medicines that target more beta amyloid, some of this sort of junk you get in the brain. The pharmaceuticals like Aricept is an anticholinesterase inhibitor, which has to do with communications, the chemical, the neurochemical that transmit between the brain cells. So I thought, well, I don't want to give bogus stuff. There's a lot of stuff on the internet. So let's actually look at empirical stuff that will help patients and do things like slow down the progression from mild cognitive impairment, which mild cognitive impairment is just, it's greater than age-related memory changes, but it's not one of the Ds, the damnable dementias. And then the Alzheimer's is really just a subset of dementia. Alzheimer's really is a specific cell type. You can only tell two ways, neither of which are great, autopsy and biopsy. But the data was showing that 30 to 40% of dementias, really abnormal problems with memory, functional abilities in everyday life, particularly in the 60 and older population, was behavioral. So if it's due to bad things like lack of diet, exercise, and sleep as the big three, what can we look at to find what are really sort of evidence-based dosages or mechanisms of treatment? So as you mentioned, my lovely wife, Alana, is a pediatric neuropsychologist. We sort of cover early childhood to very old adulthood. And then I asked my friend, Dr. Chris Friesen, outside of Toronto. Chris is a certified neuropsychologist and also a certified sports psychologist, a very hard designation to get, to divide this paper up, which we published in OBM British Geriatrics in 2018. The section editor was at Cambridge University Department of Neuroscience. And, sorry, I'm trying to get this other monitor running here. And so one of the things, and I'm going to give credit more to Chris, I've used saunas at that time for about 20 years just because I like them. Chris wrote this section. Let me go here. First, a disclaimer. This is not medical advice. Don't try any of this without talking to your personal physician, especially if you have problems with high blood pressure, heart disease, or you're pregnant. This is just information. I'll skip that one. This is the title page, Behavioral and Complementary Interventions for Healthy Neurocognitive Aging. And I'll be happy to send you a copy of that if you're interested. And Chris actually wrote the section 1.7 on sauna benefits, and found that they were not only just cardiovascular benefits, but also brain benefits. with brain-derived neurotrophic factors and IGF-1 promoting muscle bodily repair and neurogenesis. And in terms of where we got this data from, here's the references. You can see the sauna section or references 62 through 69. JAMA, Journal of the American Medical Association, American Journal of Hypertension, Neurology, European Journal of Epidemiology. So some really tier one medical journals. And I think you're probably familiar, and like a lot of us, review journals, and they're the tier one, the top of the line journals. They're the most rigorous in terms of science and research methodology. And these are all tier one journals.
Pause one here, Bob. We're just going to do identification. This is Whiskey Bravo 5 Delta, Grand Rounds on the Air Net, and we meet weekly, open to all amateurs. As Bob has an excellent discussion going on. Now, he does have slides that he's working off of where he's got his research documented. And for those of you here on 20 meters, we are doing the Zoom simulcast. But you do have access to the slides. All you need to do is bring up healthcarehands.org, bring up the website, and scroll down to the post section. And you'll have a link to the slides that Bob is using to supplement his discussion on the air discussion here. So please take time to do that. Now, we do meet every week and appreciate amateurs allowing us the use of the frequency. Our discussions, of course, are open to all amateurs. That being said, do we have anybody else that would like to check in on 20 meters or any late check-ins? Make your call to Whiskey Bravo 5 Delta at this time. Okay, now I do have some additional check-ins on the Zoom side. We have W1HMM and N4JEL. So I'm going to turn the microphone back over to K4RLC. This is AA4FL to Mike for WB5D. Go ahead, Bob.
Okay, Jay, thank you. Just about to, like I said, I'm running 4 monitors, and that's way too much technology.
Yeah, you get feedback here, Bob, from one of them. So.
Yeah.
We're fine before he was getting feedback there.
Yeah. All right, sorry. Okay. We'll just forget that one. And getting feedback. Two. All right. Wait, let me get rid of so.
This is Whiskey Bravo 5 Delta. I mean, hang on for a second, guys. My Bob figures out a little technological challenge here. Are there any other stations that would like to check in at this time on 20 meters or put some questions for or make your call to Whiskey Bravo 5 Delta?
Kilo 4 Romeo Oscar Charlie.
Kilo 4 Romeo Oscar Charlie. Thank you for joining us here today. We'll be back with our discussion momentarily. Seems like we're making progress there in Raleigh, North Carolina. Anybody else? I can't talk until I'm on the air. I'll transfer it. Okay, this is Whiskey Bravo 5 Delta. Bob, K4RLC, would you like to try again, see if we have our feedback issue gone? Go ahead.
Yeah, I think it's okay. How's the audio now, Jay?
It's great. Go ahead.
Okay, sorry about that. So too much technology. Let's see, where was I? I was saying that actually I think ham radio help with the career neuroscience because the brain is a poor transceiver. And I get this too many radios too. I apologize for losing my place here. get this one going. Things will be good. Um, so anyway, back my patients would come to us and say, "Hey, we got memory problems. What can we do about it?" And I sort of went through the state of the medicines. It's there's so much research, and at the Neuroscience Center, again, we were involved in a lot of phase 2 clinical trials, even for the latest IV medicines. But unfortunately, the results are modest. 30 to 40% of dementias are behavioral. And one of the things we found, the big three are still the same: diet, sleep, and exercise. And you can go to the CDC site to get lots of very good data now, the good CDC site for exercise. One of the things we found that was sauna actually helped both cardiac and neurocognitive brain functioning. And so we wanted to do a deep dive into that. I'd used saunas at that time, probably 20 years, but Dr. Friesen in Canada was really very interested in looking at the science. We assigned him section 7.1 of the paper, and Chris wrote that. And it really changed and made things better. Even though I'd been using a sauna, it's like I really wasn't benefiting myself or my patients from the real health effects. And so by looking at the data, we could tweak it and make it more of an intervention rather than something that was sort of nice to do. Historically, probably saunas have been around for 5,000 years. And this is interesting. This is Scarborough and Orkney Islands north of Scotland, and a Neolithic community. In Orkney, they say you live above the water and below the wind. And there were 10 interlocking homes built with very sophisticated shelves, fire pits, beds, and indoor toilets. And we just happened to be there this past summer, and the person in the white jacket there is my lovely wife, Alana. They used the old-fashioned fire kind. Then in the 1500s, Buddhist monks in Korea used this sort of forbidding dome-shaped sauna, but they used that with their version of medicine back then. And now here is the modern sauna components. And when you get down to the nitty gritty, it's basically made of a certain kind of wood, cedar, spruce, or pine that don't get hot. Imagine if you're sitting on the bleachers outside at 180, 200 degrees, it's going to burn. This wood has a good feel, doesn't get too hot, and a nice aroma. The room itself is insulated from the outside. The dimensions depend upon the user, and the heat now is really electricity instead of gas. If you're using a fire the old-fashioned way, you run problems with carbon monoxide, and we're certainly not going to do that. So we have electricity on volcanic rocks that'll get hot, stay hot, and won't burst. So where do you get those? Well, igneous rocks like basalt and granite. The core thing, here's the two real main factors that most people don't know. The real sauna is dry heat, dry in the sense of 10 to 20% humidity and a temperature between 160 and 210 Fahrenheit. But you can see this one's very pleasant. It doesn't have as many windows as some do. But this is your traditional sort of Finnish sauna. And what's the mechanisms of action? The physical characteristics at 185 degrees, your skin temperature rises to about 104 degrees, and your body experiences what's called a heat shock reaction. Blood is shunted away from the internal organs to the skin. Your pulse rate jumps about 30%, allowing your heart to pump nearly about double the volume. Blood pressure a lot of times goes down, but it could be unpredictable. So you need to sort of monitor that. And you could sweat out about a pint of fluid, 500 milliliters every 15 to 20 minutes. And that data is right from Harvard. There's a little sauna clock on the right. And you see the green part is the humidity, 0 to 20%, and the red part, upper upper left, 80 to 100 degrees Celsius. 100 degrees Celsius is really pretty rough. Most of us, let's see if this has it. Okay. Most of it have a temperature of about 180 to 190 degrees Fahrenheit. But what's the dosage? If we're going to look at this clinically and then look at the research findings, the frequency can vary from 1 to 7 times a week. The mode is 2 to 3 times. The duration is 15 to 20 minutes at a time. And the cycle is really cooling. And the fins, and show a slide in a minute. This is Finnish culture, which is the epitome of saunas. You're in the sauna, then the cold experience can be cold water, cold shower, rolling in the snow, and you do that for 2 to 3 cycles at a time. And I think Alana, she did study abroad college in Denmark, and I think they did that one from the sauna and then rolled around in the snow. And you can do it before or after a workout, and then you really want to rehydrate afterwards. So what I do mostly in the health club I'm out now, most of the time we'll just do 15, 20 minutes and go and just sit and cool down in a chair in the sort of the wet area.
Can I
So,
pause
yeah.
one second? This is Whiskey Bravo. This is Whiskey Bravo 5 Delta pausing for ID here. We have some additional check-ins on the Zoom side. We have WW6AA, K4 ROC. Do we have anyone on 20 meters? We're open to all amateurs that would like to check in and be part of the roundtable discussion, because I'm going to start asking some questions of Bob and let him continue on with the discussion. Do we have further check-ins on 20 meters? Make your call at this time.
Before I said.
Hey, Jack, KD4IZ, thank you for being here with us today, Jack. It's good to hear your voice. Any further check-ins? Okay, a reminder to you all that the slides that he's referring to, the background information for Bob's discussion, is available for those of you on 20 meters. Just go to healthcarehams.org, and on the healthcarehams.org website, you can open up the slides and view them. Is everyone on 20 meters copying me right now? The transmissions seem to be right, but I'm getting that looks like a possible fault here. I'm going to ask KD4IZ. Jack, are you copying me well right now?
100% and 10 over. Go ahead.
Okay, thank you very much, Jack. I appreciate that. You know, technology is a wonderful thing, and we're here on amateur radio, and it allows us to use the Zoom presentation for those that don't have access. And if you're an amateur radio operator, we give you the availability to participate that way. Of course, we can't do third-party traffic or transmit anyone's audio if it's not a ham, but we certainly have a way legally of doing the presentations where we're doing. And as I mentioned earlier, and those of you that are late check-ins and late participants, we thank you, Merrill, for checking in from California, and we appreciate you joining us. That we do make these recordings available on YouTube. We have a YouTube channel, Healthcare Hams YouTube channel, and in doing so, the general public finds out about amateur radio. So there's an added benefit when they look up the subject materials on these particular discussions that might involve something in the medical realm. And then in addition, they find out all about amateur radio. It's a great way to bolster our career, share our joy of having a net and having discussions of interest within our hobby and our profession. And we appreciate all the amateurs that are here on the air monitoring. And we encourage you to check in so we can involve you in the roundtable discussion. One more chance for check-ins before we move back to the discussion forum. Go ahead and make your call to Whiskey Bravo 5 Delta. Okay, no additional check-ins. So we've got Bob with us. Now, Bob, are you operating today out of Raleigh, North Carolina, or out of Myrtle Beach, South Carolina? Just a question. Go ahead.
Oh yeah, I need to change it. We're in Raleigh today. I was just down at the beach, but
Thank you, Bob. I have a couple of questions or comments, and I'm sure you're going to expand upon them. And there may be other questions and comments. We, by the way, on Zoom, for those of you on Zoom, we are monitoring the meeting chat. You don't have to wait for an exchange here for a transmission or for the microphone. You're welcome to submit questions for Bob, and we'll get them to him. In addition, we're using NetLogger. So for those of you that have not used NetLogger before, you can download that online, and you can open up, there's an instant message window within NetLogger, and you can see all the 18 stations that are checked in as of currently. So we encourage you to use that, as well as the background slides on the healthcarehams.org. So the questions that I have, the health-related questions, I think you partially answered it, because obviously if we're giving off liquid, the potential for those people that might have kidney issues, particularly those that have CKD, chronic kidney disease, they have to be concerned. And you did mention rehydrating, but I would think you probably want to talk to your doctor about that, depending upon the severity of your disease, what your GFR looks like, what your creatinine levels look like. And I'm speaking as a dentist, not as a physician. So please consult this with your physician if you have any questions. And Bob mentioned rehydrating and just sessions of 15 to 20 minutes. Bob, I'm wondering about the medical considerations for those people that have heart disease, or if maybe you had hidden heart disease, not aware of a blockage, if that change in blood pressure occurs. And then once you get up and the vessels start moving from dilation or back and forth constriction, as you go on with the discussion, there maybe you can mention a little bit more about that. Perhaps on 20 meters or some additional questions for Bob at this time. So let me turn the mic over for those that may have questions. Go ahead. So no additional questions right now, Bob, on 20 meters. So I'll let you go ahead, K4RLC, and resume the roundtable discussion, and turning the mic over to you. Go ahead, Bob.
okay, Jay, thank you. I sincerely apologize for all my technological problems. I finally got too many monitors. I've got the third monitor doing exactly the way it should behave. Hello, Jack, a fellow Tar Heel. Go Heels. Basketball team's looking good this year. I don't know about football, but anyway. And Jay's right. You really want to consult your physician. The health club I go to now is sort of a silver sneakers. Sorry, was that a question? Anyway,
Whatever you want.
older, and then one of the trainers came to me and said, "Hey, one of my guys, because he knows my background, they work with people there with dementia. I've referred patients there for years, but he's got Parkinson's and he can't work out anymore. He can't do a recumbent bike. And what are the cardio features of being in a sauna?" And I said, well, you really need to talk to his neurologist physician. One of the problems with Parkinson's is inability to sweat, which could really be dangerous. So again, consult your physicians, but I'm going to show you some data on clinical populations, especially cardiovascular. Here's my biases. I don't like steam rooms. I got a horrible bronchitis in one at the North Raleigh Y because it wasn't maintained. That took 3 courses of antibiotics to get rid of. Whirlpools and hot tubs, you've got Cryptosporidia, Legionnaire's disease, E. coli, and staph. If they're not taken care of, most of the really bad illnesses that you see in hot tubs are at hotels and resorts, or they don't have any trained personnel for that. So if they're really maintained, they can be useful. The sauna, and this is my bias, generally safe, actually neutralizes flu and COVID. COVID won't last over 160 degrees. So if you're in a sauna at 190, you're going to neutralize, not like autoclave, but cold and flu viruses are made inactive around 133 degrees Fahrenheit. A whirlpool to me is just a petri dish, and a steam room is not much behind that. The other thing about sweating, dry heat versus wet heat. Remember the Paris Olympics, there were problems. One, the Olympiads athletes had to do heat training, which you can do as an athlete. Like I say, I've worked with college athletes, National Hockey League, and spent a lot of time understanding their neurophysiology as well as their physiology. Um, so you have to be, to me, really, really careful in those hot, wet environments that will just grow germs and bacteria. So I haven't been in a steam room since I had horrible bronchitis years ago, and I feel about the same for whirlpools. The other temperature-based intervention that I haven't tried, we've done New Year's Day swimming, but it's the cold water immersion. My spine doc, uh, he's a little bit like a dentist. He bends over a gurney doing spinal injections, and Jay probably had some cervical spine, lumbar spine problems. And Dr. Rice likes the cold water immersion. He claims wonderful benefits in about 5 minutes as opposed to 15 to 20. So the fins go from heat to jumping in cold water, but some athletes now would just use the cold water immersion. I haven't had the courage to do that, but we have done the polar bear plunge, which don't stay in long enough to get any effects of that. Okay. So we've talked about, saunas, but what's the quintessential sauna is the Finnish sauna described. Actually, the UNESCO it has the Finnish sauna as an intangible cultural heritage of humanity. There are more saunas than cars in Finland, 3.2 million saunas in Finland, and it's used as a standard for medical research. Finland does not regard infrared as real saunas because with infrared, you're actually standing in front of a device that heats the skin with certain frequencies. Now, we were in a conference, I don't know, 10, 15 years ago in Helsinki and took the kids over when they were in high school, got a nice room, and said, wow, this is really great. What is this room? Open it up, and there's a sauna in our hotel room. It actually was a business suite, and the business guys would go in there and gals would go in there and do business. The world's largest sauna holds about 160 people. Is on Simulin Island, which we were on in the Bay of Finland. I bet it had a wonderful odor after all those soldiers. But so we're going to use the Finnish sauna as the standard for research and intervention. The overview, here's just sort of an overview in the general population. It promotes relaxation, reduces stress and insomnia, improves heart health, improves respiratory functioning, reduces inflammation, may reduce incidence of dementia, and may support longevity. Again, there's a research base to all that I'm giving. The last two, when it says may, it means there's good data. The first four, there's really excellent data in terms of as good as data can be in a scientific sense. And here's a little bit about what Jay was talking about. This is a review article from Hussein and Cohen I found in PubMed. We're actually looking at some very serious illnesses on the left, cardiovascular, improvement in congestive heart failure, improvement in peripheral artery disease and ventricular arrhythmias, ischemic heart disease, and coronary artery occlusion improved. But I would only do this under the guidance of your cardiologist. The one that really surprised me is this one with the ventricular septal defects in infants. That is an extra opening between the ventricles, and that in this group of 12 infants, 9 of 12, after treatment in the sauna, did not need surgery to repair the opening there. So actually, these were patients with pathology who went in and under medical supervision and a rigorous protocol had good cardiovascular benefits. But and I hadn't really thought about kidney for clearance, but definitely that would be one, or anything where there is illness to get medical clearance. Other things you sort of think of, chronic pain, rheumatoid arthritis, and ankylosing spondylitis, COPD and allergies for breathing, mild depression, but not really moderate to severe, or insomnia. So this is an article that was clinical effects of regular dry sauna bathing, and I found that in PubMed last week.
Let's pause one, Bob, just for ID. This is Whiskey Bravo 5 Delta AA4 FL for Mike pausing for ID. This is our grand rounds on the internet. We meet every Sunday at this time on this frequency. I've done so for years. Thank you for those amateurs that are allowing us the clear use of the frequency. We do realize that this is in the range of frequencies since for Parks on the Air, and you're often looking for Parks on the Air here and come upon our transmissions, but I assure you we've been on that frequency for many years before Parks in the Air, and so it's not intentional that we've chosen that. It's a tradition here. In addition, for those of you that are here on 20 meters participating, if you would go to the website healthcarehems.org, on the entry page, if you scroll down to the post section, it's a little bit down on the right-hand side, you will find a link to the background material that Bob's talking about, the slides that he's working off of here and leading his discussion. It helps to organize our thoughts. Bob and I are not spring chickens anymore, and we both need our props. So please accept that requirement for us. And we do use those as we do our net, which is expressing our passion for subject material and amateur radio at the same time, and you'll be able to look for this as a recording on Healthcare Ham's YouTube channel. So probably by the end of the day, by tomorrow, we'll allow you to share the topic material with friends and family, and we'll also expose them to amateur radio, and we'll learn some of the quality uses for amateur radio, and that it's still a vibrant hobby. It's a modern hobby. That being said, and we're open to all amateurs, do we have anybody else that would like to check in on 20 meters? Make your call now. Whiskey Bravo 5 Delta. Okay, no additional check-ins at this time. My home phone was AA4FL, Alpha Alpha 4 Foxtrot Lima, operating out of Hawthorne, Florida, for those of you with directional antennas. Now, Bob, we haven't asked for any questions here on the Zoom side. So if you're an amateur radio operator and you're on Zoom, we'll be more than happy to have you be involved in the net here with the net control. I'll go ahead and make a list for those of you that might have questions to ask Bob. So let me go ahead and pause one and go ahead and let us know who would like to ask questions.
And to OMD.
Okay, we have N2 OMD. Anyone else?
For TSC.
N4 TSC for questions. Anyone else? Okay, let's start here on 20 meters and turn the microphone over to N2 OMD. Go ahead, Tom.
Dr. Mike Delta. What I want to do is basically amplify your comments about the hot tub. Many times when I look out on the home uncertain, and when I was a student back in the 70s, I was in a biochemistry lab doing enzyme purification, and we knew we had the right tubes with enough protein in it because we see foaming on the surface. So when I had hot tubs, it shows to me there's a lot of protein in there, and I don't want to give in other people's protein. So N2 OMD, BD, N2 back to you.
Okay. Thank you, Tom. Bob, were you able to copy the audio? I know the audio was a little bit lower. Were you able to hear the comment from Tom? Over.
I'm sorry, Jay. I'm got a bad copy here. Could you summarize that, please?
Tom, you'll have to correct me if I'm paraphrasing you wrong. He had mentioned that he had been doing some research and looking at test tubes, and at one point, there's different proteins that would show up in these samples, and he would hate to see that happen while he's recreating there. So did I copy that correctly, Tom? N2OMD, go ahead one more time. No, the audio is just too low. We're not having a direct line to our Zoom transmission. So Bob, I'm copying you, but he's not hearing you through Zoom. Over.
All right. Basically, what I'm saying when I see small on a certain that means protein, and I don't want to jump into a couple of other people's proteins.
Okay, QSL. So he's just mentioning his disdain for hot tubs too, because the proteins you share with other people that do happen in hot tubs. So thank you for pointing out about the dry heat, and I'll let you elaborate on that right now. K4R RLC, go ahead.
Yeah, thank you, Tom. It's a mess. Again, they have to be properly supervised, and it's a great culture for growing bacteria and viruses and proteins. And at our health club, big signs: take a shower before you go in, take a shower when you get out. And unfortunately, there's the human factor, and people don't comply. So I feel good with the sauna, with the heat, especially when it's around 190 degrees. This really surprised me. Risk reduction, and then again, this is from the Finnish. We're going to use the Finnish sauna as the quintessential method for say like in a study. Okay, we're going to use. Sometimes you see a wet sauna. There's no such thing as a wet sauna. A wet sauna is a poor steam room. But look at this data. Sudden cardiac death reduced by 66%. All-cause mortality 40%. When the dementia and Alzheimer's 66 and 65%. But the Alzheimer's study were Finnish men who saunaed 4 to 7 times a week and did that cycle of hot, cold, 2 to 3 times each day when they did it. And then the heat stress reaction for cardiovascular, again, decreased systolic and high and low measures of systolic and diastolic blood pressure, increased heart rate variability.
Bob, in just a second. We did have another question. I'm going to let you continue on.
Oh, go ahead.
We did have another question here from N4TSC. And Jerry, before you ask your question, make your comment, I also wanted to have Bob respond after he's through with yours. Do the Finnish use their saunas? Their dry heat saunas for light therapy? Do they combine it? I mean, the reason why they're in there is it's really cold, and I assume it's dark in Finland, especially as you go further north. And I'm wondering if they combine light therapy also with that. So M4TSC, let me turn the mic over to you for your comments and questions. Go ahead, Jerry.
Yes, I do appreciate the presentation. I'm just wondering, for someone who hasn't participated in this previously, what kind of protocol is there for dealing with and recognizing the possibility of the shock, first of the sauna from the heat, and then the sudden change in temperature when you go into cold? I just anecdotally, I can tell you, if my pool temperature is 80 or close to it, it takes me about 6 laps in the pool before I adjust to the temperature. And it would seem to me that changing the temperature suddenly would be a shock to my system, which might lead to immediate cardiac arrest.
K4LC, do you want to respond to that concern? Go ahead, Bob. Okay, I think we lost.
Yeah.
We're back. Do you want to go ahead and respond to that, Bob? Go ahead.
Yeah. Sorry, I had to listen to Jerry on a different device yet. Sorry about the technological snafus here. Yeah, I mean, that's one of the things, again, Um, I think it's something you would, again, clear with your personal physician, especially if you have any cardiac issues, and something to work up with. The Finns start this in early childhood and work with it going up through late adulthood. So yeah, that's sort of between hot and cold stress could really whack you out. And it's interesting, in Florida, you're talking about 80 degrees. I guess you guys are really used to warm heat down there versus growing up uh, in Finland or Norway or Sweden or the Orkney Islands, where you're closer to the North Pole than you are to the equator. So,
Bob, I've got another question for you that expand upon Tom's comments. So and you had mentioned the bacterial growth, and Tom had mentioned the bacterial growth. And that maybe my understanding of bacteriology isn't perfect. I mean, but hot tubs, we're talking about using chlorine to kill the bacteria, because if you didn't take care of them properly, I would suspect that you get this enhanced bacterial growth at a higher temperature, a quicker bacterial growth for some bacteria. And uh, you're not going to reach the temperatures necessary to kill them. So you're relying on chemicals. Is my perception correct? Is that why it's problematic if they're not well maintained?
yes.
Go ahead, Bob.
Oh, great point, Jay. Yeah, exactly. That's it. I mean, you're basically, making your bacteria there in that medium. And again, if it was hot enough to kill, you'd be actually getting first degree burns to people. Um, and that's why one of the health clubs we go to, the North Myrtle Beach Aquatic Fitness Center, which also has the pools for all the high schools there, that they have a industrial strength whirlpool that's checked about 3 or 4 times an hour. Uh, but yeah, it's unfortunately a perfect medium for growing things that are not healthy.
Thank you for answering that question. Are there any additional questions or comments from on the 20 meters side? And Tom, do you have any follow-up comments into? Oh, and David, go ahead and open up the mic on 20 meters. Make your call. Okay, no additional comments. Do we have any further questions here on the Zoom side from amateurs that are monitoring by Zoom? Go ahead. Okay, again, for ID purposes, this is Whiskey Bravo 5 Delta, AA4FL, the microphone operating my home station is in Hawthorne, Florida, in north central Florida, and our transmissions that are occurring on 20 meters on my part, or from the Zoom audio, are originating from my station, following all the specifications of amateur radio and the requirements for transmission. And I'm going to turn the microphone back over now to Bob, K4RLC.
Thank you, Jay. It's Bob, K4RLC, opining here, and hopefully you're finding this interesting. I mean, the idea is that you can use the sauna. I use it as part of a cardio and strength training workout routine, but you can use the sauna just by itself. And that's what some of the patients, when I said to them, well, you really need to go to the gym, get on the treadmill or the elliptical, and they're going, I ain't going to do that. So, well, at least take some stretch classes and get in the sauna. But this heat stress reaction, some of the cardio things, increase heart rate variability, and that's a subject that Alana and I actually published another paper on in the Frontiers series, and we're looking at Jack, one of the neuropsychologists in the VA, was doing a group of papers on heart rate variability and post-traumatic stress disorder, and he sent me an email and said, hey, I think concussions affect heart rate variability. You know anything about it? And I went, well, no, I'll look it up. And we wrote this paper, and it's turned out to be in the top 95% of downloaded and viewed papers for the Frontier series. Heart rate variability is good. It's basically measuring the interbeat interval. You don't want it to be like a metronome. You want some variability between the spikes, and it's an indication of cardiac health. Other things reducing epinephrine and norepinephrine, increasing nitric oxide, and increasing the brain-derived neurotropic factor, which helps with neurogenesis, especially as we age. Okay. Adverse effects. Yeah. For males, I think low sperm count is something, especially if you're sort of in the childbearing range. But it's reversible with abstinence. Other athletes that have low sperm count are bicycle racers, and some studies initially done with the Italians. And then heat discomfort. Some people, I'm in the sauna all the time talking, and people say I can't stand it, and I'll say, well, you have to work up for it. You can't really change the temperature, but spend less time and do that heat exposure, sort of like what the Olympic athletes did in Paris. Some feel claustrophobic, some feel bronchitis, although it's the opposite of that. But sometimes you'll feel the cardiovascular effects. You'll get a little dizzy, lightheaded, woozy. If you have any of that, get out of the sauna right away. But in general, not as many adverse side effects as you might expect. You don't get burned. Go back to that wood, cedar, or pine. It feels good, as opposed to, say, sitting on a metal or fiberglass bleacher at the football stadium in a really hot game. And the myths, and this is sort of what Jay was alluding to earlier, unfortunately, weight loss. Yeah, you lose weight, but it's water weight and it's not fat. I wish it was. People say, well, you detoxify. No, not really through sweating. Detoxification, liver, kidney filtration, digestive process. Immune functioning a little bit. If it's extended, you can overstress your immune system. And then, of course, it's not a panacea. Sauna doesn't magically melt away stress or cure medical conditions. It's a really nice intervention if you like that. But it's not like, I remember our son was wrestling and he wanted to reduce weight to get in a lower weight class, and some of you may have been wrestlers, so you would try to make weight, go in the steam room or the sauna and sweat it out, and then go for the weigh-in and boost back up to your normal weight. Okay, working out in saunas, we've been talking about this. Working out is generally not recommended. One of the nice things, I'll touch on this later for a minute, is actually the social aspect, talking to people. And now I've met these people, I don't need to work out, I can just sit in a sauna. Doing exercise is generally not recommended, but saunas are considered a mild cardiovascular exercise. But it doesn't meet the CDC recommendations. 150 minutes of moderate, your heart rate 60 to 70%, or 70 minutes of vigorous. And you also don't experience the positive effects of weight-bearing exercise that help with joint and muscle health. So you don't want to get in there and start doing push-ups and jumping jacks. But what do you want to do? Okay. So the Finnish culture, Jay, you had asked about the light boxes. Finland, the Finns are supposedly some of the happiest people in the world, but there are unfortunately high incidences of depression and alcoholism, probably from the super long nights during the winter. And they have sort of a culture that's not as much lit as this one, but a nice, low-key, gentle place to go. What can you do? What do I do? Sometimes I meditate, pray. It's a wonderful place to pray. It's a wonderful place to do Morse code practice. Take an MP3 player. Also, several of us will do our physical therapy exercise and stretches. My routine, and I'm certainly not spring chicken, I'm 75, but I've been still trying to do vigorous workouts. I've done marathons, half marathons, hiked and run on the Appalachian Trail. Used to be a rock climber, cross-country skier. Because of some orthopedic stuff now, I can't run. And our Jen, our physical therapist, both Len and I see Jen. She's our best friend. But after I'll do 20, 25 minutes of cardio, high intensity on the elliptical, and then do strength training, which is either free weights or weight machines, and then go into the sauna, which is sort of a reward, and get really nice and warm and do exercises or yoga or socialize. Some of the most interesting conversations I've had have been in the sauna. Like last week, I'll touch on this in a minute. It's a co-ed sauna. You have to keep your clothes on. It's co-ed, and there's no light in it. And talked to a lady, and we ended up praying together for problems she was having with her son. And then she left, and I started talking to the guy next to me who worked for GSK. GlaxoSmithKline still has a small factory here in the Research Triangle, but he came over from England, and we were talking about medicines like Wellbutrin. And another interesting one, I talked to a nurse, a male nurse who worked with the Hyperbaric Oxygen Center at Duke and also with a diver. And then a guy who used to be a cop in New Orleans, and found out the cops in New Orleans don't have safeties on their revolvers because it could add another 10 seconds to the time they needed to utilize that thing. So it's really fun. Now here's the experience. The same sex old boys club, and I've done both, and usually at the Y's, and you get guys doing what guys do in the locker room. They're supposed to be clothed, they don't, and they're as Archie Bunker used to say, they're preverts. There's some creepy things sometimes. When there's mixed gender clothed, it's a nicer atmosphere, it's quieter, it's more respectful. And lights versus no lights, most of the time is sort of natural lighting from the room outside. If it's well lit, you see your imperfections too much. And if it's dark, it's sort of creepy. The Finns like sort of a medium light that promotes relaxation and a meditative state. The light boxes, probably they sell a lot of those in Finland. I don't know, but I think it's an empirical base for treatment for depression, especially for seasonal affective disorder. And just to sort of
ID here. This is Whiskey Bravo 5 Delta. ID purposes, Whiskey Bravo 5 Delta Grand Round on the air net, transmitting from Hawthorne, Florida today, having a roundtable discussion here on our net, sharing our passion for amateur radio and topics that are medically related. And our speaker today, or our presenter today, our leader, I should say, in our roundtable discussion is Bob Conder, K4RLC in Raleigh, North Carolina. Appreciate all the amateurs that are allowing us the clear use of the frequency. We're just getting to past the noon hour, and we'll be wrapping things up here soon. Do we have any late check-ins at this time? Make your call, Whiskey Bravo 5 Delta.
Victor Hotel, K4 GVH.
Okay, thank you, K4GVH. Thank you for being here with us today. Any additional check-ins? Okay, I am located. This home call is AA4FL in Hawthorne, Florida. K4 GVH. Thank you for being here. Do you have any questions of the speaker? Go ahead.
This is K4 Golf Victor Hotel, K4 GVH. Good afternoon there to you. I don't know where you're at in Florida, but I'm a blind ham. I tell you a little bit about myself. I've been blind since birth, and but I checked in here this morning, and how is the weather in Florida? How is the weather? It is cold here, and tonight it's going down to, they said we're going to be in the teens, and it's going to be down to 10 to 0 tonight here in Virginia. There, over.
Okay, well, thank you very much for being here with us today and checking in. You know, we're the Medical Amateur Radio Council. We do have many of our members that are, that are associated with limitations such as blindness, and some researchers actually. One of our members works on the JAWS software. He's actually a PhD and a dentist, and also does computer programming. So That's a good future net for us to talk about amateur radio and blindness. So thank you for being here today. We will be more than happy to have you with us every Sunday. We do have other nets. We have a digital net, and we're trying to put together a 40-meter net for the evenings, but Sunday morning's not the best time for everyone. But thank you very much for checking in. Again, we're getting kind of long in our time here. So I'm going to turn the microphone back over to our lead for the discussion, K4 RLC. Go ahead, Bob.
A4FL, K4LC. Well, it's good timing. This is the last slide. It's a summary and try to put everything in one slide. Physical characteristics of what it really means to have a sauna. The classic Finnish sauna on the left column, and the reported benefits with the data, evidence-based data on the right. And again, we can't do visuals over 20 meters and then realize there's some people who have visual limitations. So I'm trying to describe, I think temperature, just to summarize, you want the temperature to be about 180 to 200 degrees Fahrenheit. 190 is really good. The humidity has to be 10 to 20%. If it's more than that, people call it a wet sauna. It means they've either got a bad sauna or a cheap steam room. Duration, 15 to 20 minutes. If you're medically cleared, not having adverse side effects. Frequency, 2-3 times a week. You can do it before or after exercise. I know some of the people at the gym go in before to get warmed up so they can exercise better, and then they come in afterwards. The way we heat now, the old days in Finland, prehistoric, Paleolithic, was fire and having a smoke sauna like on Skara Brae. But now basically we've got an electric burner on volcanic rocks. You want these volcanic rocks because they can get hot, stay hot, and not explode. You want the wood to be cedar or pine that feels nice, and then low lighting and a relaxed atmosphere. And there really is I could go for an hour about the Finnish culture. And then that's the way they really like it, low lighting, relaxed atmosphere. And then you don't want to drink, you don't want to consume alcohol, drugs, anything like that. It's really for health. And some of the health benefits with data, the general one, relaxation, reducing stress, insomnia. A lot of good cardiovascular benefits to the respiratory tract, reduces inflammation, which may reduce pain, and then may reduce the incidence of dementia because it is shown to increase brain-derived neurotropic factor, which helps increase brain cells, which we sort of lose as we age, and may support longevity. But you have to go back to the data. The last two are actually the Finnish studies with doing the sauna 4 to 7 times a week and doing that cycle, 2-3 cycles, sauna, cold immersion, sauna, cold immersion. So I think I use the sauna as part of an intense workout regime, but you can do it just by yourself and get some pretty good benefits as opposed to other things. So I appreciate you all listening to me ramble here. Again, I apologize for all the technological problems. It's a rarity, but it usually happens. The technology has an anxiety detector. But any other questions, you can email me, or I'm happy to consider any other questions, entertain any other questions now. Back to you, Jay.
Oh, thank you very much for leading the discussion today, Bob. One question, Bob, for those that want to email you that are amateur radio operators, do you have your email address listed on your QRZ page?
Yes, and on the healthcare hams, wild apricot also, but it's on QRZ.
Okay, so for those of you that are not members of the Medical Amateur Radio Council, you certainly if you're a ham, you've got access to QRZ, and you can email Bob directly. There's a little bit of information though about our website. So the healthcarehams.org website is open to the entire public, and if you're not a member and you're not logged in, you will still be able to see things such as the posts that we place on there. I believe we do. I hope so, because I'm telling you about the slides being posted there. But Bob, if you want to have us post your paper there, you can email me the paper, and I'll be more than happy to make it available as a link through the internet on the healthcarehands.org website, so everyone can look at the science. But if you are a member, or if you would like to join as a member of Healthcare Hams, the Medical Amateur Radio Council, there is a join page there, and you can process everything electronic. So why would you want to join? We certainly don't require you to join. We're open to all amateurs here on our net, but we do offer some benefits that if you're a member, you'll be able to access all our past recordings that are also listed by subject matter. In addition, we have our publication, Ether, which is a quarterly publication that you'll have access to the entire archives. Now you can find the last 3 or 4 editions for the general public, but for the full archives, you need to be a member of the Medical Amateur Radio Council. Do we have any questions about the Medical Amateur Radio Council, which we also are known as Healthcare Hams? Do we have any questions right now in 20 meters? I'll be more than happy to answer them. Go ahead and take the mic. Okay, well, none here. Any further questions on the air off 20 meters for K4RLC, our lead for our discussion today? Make your call. Okay, for those of you that are coming in by Zoom, we're going to go ahead and end our 20-meter net, and we will maintain Zoom for a while longer for any discussion for those people that are coming in outside of amateur radio. We're going to return the amateur radio frequency to the general amateur community. Thank you for those that have allowed us the time and have a clear frequency. And we look forward to next week, where we're going to be talking about the holidays, stress in the holidays, and health during the holidays. We have Christmas coming up very quickly. And if we don't talk to you between now and then, we wish you a Merry Christmas and a Happy New Year. We know it's a busy time of the year and not everybody can participate. This is AA4FLJ at the microphone. We've been transmitting here from Hawthorne, Florida today. And we do appreciate everyone that participated. For that, I'm going to say 7-3, go QRT, and turn the frequency over for general amateur use. 7-3. I'm still on Zoom, guys, so I'm not going to transmit the Zoom. We'll leave the frequency open. QSL, Bob, so you want to go ahead and talk to the Zoom group here?
Oh, sure. Yeah, you talk about working. Our son-in-law is at a half Ironman near you today. I'm not sure. It's not a Disney one, but it's near Jacksonville. You talk about intensity of stuff, and I'll say he's an Ironman, and Colin always says, no, I just do half Ironman. But still, that's, running a half marathon, swimming a couple of miles, and bicycling 60 miles all at one time. In terms of cardio stuff, it's amazing. He's trying to decide to do a full Ironman, but I used to run marathons and would bike 100 miles a day. I was a lousy swimmer, but I think you can tell I really enjoy vigorous exercise and try to do it. But
I'm going to go ahead and stop the recording on Zoom that we're going to be using for our YouTube presentation. Thank you for all those on YouTube that listened. We hope you found out a little bit about amateur radio and a lot about the subject material. And it was quite an honor to have Bob on with us. If you go through our recordings on the YouTube channel, you'll find other discussions that were led by Bob and his wife, Alana. They're very generous in sharing their knowledge. Alana being a specialist in the pediatric realm as a neuropsychologist, talked about some of the sports aspects of sports medicine and traumas, head traumas to young children. I believe that's a recording on there. And Bob has spoken about neurological conditions before too. So before I close the recording, please be aware of that. I'll let Bob give his departing greetings for those of you that are on YouTube, and then we're going to continue on our local personal discussion. Bob?
Well, thank you, Jay. Thanks for letting us have an audience to do this. Like I said, I've been a member of Marco probably 25 years, and for so many years was listening to Warren. I don't know how he did it week after week with just, quality continuing medical education presentations and doing the ether on a monthly basis. I think we all are still in awe of Warren and what he did almost until 100 years old. So I'm trying to carry on a little bit in Warren's tradition here, but thank you for letting us do this. Hopefully it's helpful. I think it's really pretty cool to combine ham radio and healthcare medical things, and hopefully reaching a larger audience here.
Yeah, thank you, Bob. And I'll also mention the background here on the screen. And we stopped the share of the slides, and you can see behind Bob the pitons in St. Lucia. They're talking about exercise physiology. The big one on the left, and that's the national on the flag for St. Lucia. Bob climbed Grand Piton, and Bob and I climbed up a Telegraph Hill to operate radio from the top of the northern side of the island. So yeah, he is an avid climber. I could not do the Grand Piton, the 300-foot hill. That one I struggled with Bob's help. So I'm going to go ahead and stop the recording. But for those of you on YouTube, these are the kind of things that amateur radio operators do. We were going on a trip. We were operating remotely. We operated in a contest. We got on the radio. Amateur radio is not one thing. It's a collection. Some people do satellites. Some people like to do emergency communication and work with their local law enforcement on that when there's emergencies. There's special federal training for that. Other people, they like to go into parks and put parks on there and talk to people in other national parks, to climb mountains and operate radios from the top of mountains. It just goes on and on. It's not one hobby. It's a modern hobby. There's a lot of digital communications, and I encourage any of you that want to find out about amateur radio to look for the American Radio Relay League, ARRL.org, or just Google amateur ham radio, and you'll find so many fascinating aspects. So you're welcome to come back and join us in further healthcare hams videos.